Hello, Rachel. Can you please introduce yourself?
Hi, I'm Rachel Solano. I am 29 years old and I live in Calauan, Laguna.
Okay. Are you single or married?
Single.
Single. Single mother.
Single mother. And I have two kids, 8 years old, the oldest, and the youngest is 6 years old.
Okay. So where is your partner? Still together or
Not,
no communication?
no communication.
Okay. So who's the one to take care of your kids?
The oldest is him, with him, and the youngest is with me.
I see. Okay. And what about your religion? What is your religion?
I am Iglesia ni Cristo.
Christian.
Yes, Christian.
Okay. And what about your educational background?
I am graduate practical nursing, healthcare assistant pharmacology.
Okay.
Then I take it 2 years and 1 year training.
Okay. So only a vocational course,
Yes,
and you don't have a nursing license.
it's only a certificate.
Okay. This is your first time to apply in Hong Kong or to
Yes.
apply abroad, right?
Yes,
So what sort of working experience do you have here in the Philippines?
I have worked 2 years and a half in a hospital.
Okay, what are you doing in the hospital?
I am assigned in intensive care unit or ICU, the adult.
Okay. So because you are just working as an assistant, right? Not a proper nurse. So what can you do?
I always assist. Maybe it's not I'm a proper nurse, but I always learning inside the intensive care unit. They also have to learn. Maybe it's not a registered nurse, but if you want to learn anything, you do, and then you always assist. I always assist sometimes the doctor.
So you have met different kind of patients, right?
Yes, ma'am.
Do you have idea or have you experienced how to check the blood pressure?
Yes, ma'am.
Or maybe if someone has a wound, at least you need to how to handle the wound.
The one.
Yes.
Before in the hospital, before you take the patient, of course it is you need to ask the operating room, because the operating room is the one that handle in the person who have wound.
I see. Okay. So what sort of job do you want? You want to, because now you're applying as a domestic helper, right? But there are so many different kind of domestic helper. Let's say domestic helper for taking care of kids or domestic helper for taking care of elderly. Which one do you prefer?
Any madam, because I have a kid, so I have an experience how to handle the newborn, the young baby, the child.
Okay. So if I have two jobs for you, okay, one for taking care of newborn, one for taking care of young children, which one will you choose?
Anything, madam.
Anything, even newborn you accept?
Yes.
Okay. From your experience, you use bottle feeding or breastfeeding?
Bottle feeding.
Bottle feeding, okay. How you sterilize the bottle?
First, madam, before I take the feeding, I always wash my hand first. Then I always boil water for that, and first wash the soap, the bottle, then sterilize.
Okay.
Steam.
Steam.
Yes.
Okay. And what is the procedure to mix the milk in a bottle?
After I sterilize or steam the bottle, madam, I put first the water, sterile water, or purified water. Then, madam, the formula milk.
Okay. And after you're feeding the baby with a bottle of milk, what do you have to do to the baby?
I take care to birth, madam.
Okay. And what about taking a bath for the baby? Which part of the body you wash first?
Based on my experience, madam, I told my mother, she always helped me to teach me, like always bath the baby. First is the head part, then the body, and then the private perineal, and then the face. The face.
Last is the face. Okay. Like different employer have different requests. Okay. Some employer they like to use the clean water to clean the face first.
Yes.
Before you wash the hair or the body of the baby. Okay. But anyway, you just follow your employer experience, your employer's instruction. Okay. What about when the baby has a fever? Do you know how to check the body temperature?
Yes, madam.
What do you use?
I always use temperature yung thermometer.
Yes.
Then,
Do you know how to use the digital one from the
Yes.
check from the ears?
in the hospital, madam,
use the
I use
digital?
the digital in the ear, sometimes the underarm.
Okay.
Then,
One is the normal temperature.
the normal temperature, madam, is about 36.5 to 36.2, 37.2 rather.
Okay. When the baby has fever, what you normally do?
First, madam, if in the hospital, madam, I always inform the doctor of the baby.
Okay.
Then the doctor reply what's the order.
Okay.
Give.
Just like when you are taking care of your employer's baby, okay? When you found out the baby has fever or whatever, something happened to the baby,
Yeah.
inform the employer first.
Yes, inform the employer first.
And let the employer give you instruction,
Yes.
okay? Don't give any first aid, don't give any medication
Yes.
without permission, okay? From your experience, when the baby is around 6 to 7 months old, what kind of soft food can you prepare for the baby?
Based on my experience, madam, soft food like potato, you give a boiled potato, then the crushed potato, then give the baby, and then
Okay.
the water.
Have you experienced to cook congee, soft rice?
Yes, madam.
Okay. Do you have any food allergy or skin allergy?
No, madam.
Okay. If I let you share room with the newborn baby, are you willing?
Yes, madam.
So meaning you have to wake up in the middle of the night to take care of the baby, huh?
Yes, ma'am.
And also working in the Hong Kong, we don't usually let the helper take afternoon nap, okay?
Yes, yes, ma'am.
But if you need to take care of newborn and wake up frequently in the middle of the night, of course, the employer will give you some resting time in the afternoon,
Yes,
okay?
madam.
What about general cooking? Let's say food for the employer or for yourself. How good is your cooking skills?
Because this is my first time to go to abroad, I do cook Filipino food.
Okay. You are the one to handle cooking in your house?
Yes, madam. After my duty, I take care of my children. I cook them. I always prepare.
Okay. Do you have any food allergy or skin allergy?
No, madam.
Okay, and you eat all kind of food, right?
Yes, madam.
Okay. Do you smoke?
No, madam.
Okay. So what can you promise to your future employer?
I promise to be loyal first. Then my contract, I always follow the rules and regulation in Hong Kong. And then always follow the employer. Then I always finish contract.
Okay. Make sure you have no homesick, huh?
Yes, ma'am.
If I give you a job to share duties with other co-workers, are you willing?
Yes, ma'am.
Are you afraid to dogs or cats?
No, madam.
Not afraid, huh? Okay. If the employer cannot give you day off on Sunday, only Saturday or weekdays, is that okay?
Yes, ma'am.
Okay. So thank you, and I hope to see you in Hong Kong soon.
Thank you.